Let's talk on HIV/AIDS and the fact that we're starting to see antiretroviral treatments being a very big player in ensuring that the quality of life is increased. What is your stance on this? Are we doing enough?
Thank you very much to invite me in your broadcast. We are, as the French Red Cross, a partner of some 6 Ministry of Health in Africa and with national societies to allow access to antiretroviral treatment to people. And this we have been doing it since some more than 15 years.
Is it on a sustainable basis, however, and what kind of penetration are we looking at of ARVs?
The sustainability of accessing the treatment will be allowed if people go regularly to take their treatment. So that is my first message here, is to encourage people that are under treatment to not stop to take the treatment. If not, we go to treatment failure, and this treatment failure will create resistances, and that will not go in the way of sustainability for improving the fight against the epidemic.
With regards to the Red Cross's approach to tackling HIV/AIDS, it's not just about the ARV treatment. We're also looking at the psychological, nutritional and social side of things. What headway have you made, Antoine, in this regard?
Effectively, we in the 90s, when we have started to fight against HIV/AIDS, most of the countries we were working in had very weak medical organization, and to address properly the fight against HIV/AIDS, even before antiretroviral treatment arrived on the market in about '96, it was necessary to create an integrated center, to have an integrated approach. That's why we created this daycare center to address all the issues together and to help people affected by AIDS to be properly cured, not only by accessing treatment, but also for psychological support, then nutritional reinforcement, because without good nutrition we know that it's not easy for the treatment to be properly operational. And then of course to allow screening to people in these centers. Those daycare centers as a concept were to have a global approach all together in the same place.
Antoine, how many people are you reaching? How many lives are you affecting through these daycare centers that you've put in place?
Today, it's about 15,000 people in 5 African countries that are under antiretroviral treatment in our daycare centers. But those daycare centers, as I told you, had as a mission in the 90s and early 2000, the year, to demonstrate in Africa, when most of the people did not believe that treatment was possible in Africa. So our daycare centers had a mission to demonstrate that it was possible. So now that it is done, that everybody is convinced that treatment is in the center of the good fight against HIV/AIDS, and the first axle even within a good prevention strategy, this daycare center had to go to reinforce now the infectious diseases department in the hospital, national hospital, regional hospitals in the countries.
Antoine, just also focusing on clinical research, I know you offer support with regards to this. What kind of trends can we expect going forward when it comes to clinical research? Are we looking at prevention, or are we looking at a possible cure down the line?
I think the clinical research is much more oriented in the clinical than in prevention. And still, as I told you, the clinical is the center of a good prevention strategy. Today, we are very aware that each year we make tremendous progresses to improve the treatment. Each year there are new molecules that are found and that are available on the market. You can be treated with 2 pills a day now, and that is also very important. Still, I say to people that are watching us that the treatment is available, is free of charge in quasi all of the countries. And the earlier you go to screen yourself, if you are positive and you put yourself under treatment, that is much more easy than before. I tell you, 2 pills a day, and you can then have a real good life for many years. So clinical research is really making considerable progress and still going on.
Fantastic, Antoine. We have to leave it there, sir. Thank you very much for joining us, Antoine Peigney, live from Libreville.